Dr. Melanie Schwartz from Viewpoint Psychology and Wellness, our first guest today on the Oakland County MegaCast. Dr. Schwartz, thank you for being with us again.
Thank you for having me again.
Appreciate having you on. How have you been since we last spoke?
Doing pretty good. Busy with work, trying to enjoy summer and the warm weather.
Oh yeah, we're all surviving it. It's gonna get a little bit hotter here in the next few days, but we'll be back down to some moderate temps pretty soon. So as the pandemic goes on, what are you noticing in terms of people's ability to overcome the stresses of everyday life? How are those stresses continuing to change, and how are people needing to continue to work through adjusting to those changes to avoid this anxiety becoming crippling?
Right now, for a while, people's anxiety seemed to go down a bit, and now I'm noticing a trend up again. And the anxiety's changed, whereas before it was very focused on the virus and not knowing anything about it. And now it seems to be focused on the unknown of the fall and not knowing if the kids are going to school or if teachers have to go back to school, or if it's going to be, people like you guys were just talking about, planning for childcare and what that's going to look like, myself included. So there's a lot of anxiety related to that. And the more information we hear, the more anxiety people have. A lot of times we think information tends to help reduce our anxiety, but I think right now it's increasing our anxiety. So one of the best things to do right now is to limit how much you're reading or hearing about it, because the more we hear and we don't have any definitive answers, the more anxiety we have about it, because we're just thinking about it and not able to get away from it. And that's not healthy to focus on all the time.
And Dr. Schwartz, on that note, thinking about returning kids to schools in the fall, it's easy to think about the anxieties that are there for parents. They're thinking through childcare. They're thinking through, how am I going to balance work and the kids' schooling again if I work from home and they're online schooling? How am I going to balance the kids' schooling and my working if I'm going into the office and they need to be at home and I'm not, and there's no one there to supervise them, or I need to take them to another location? But we don't often think about the other side of the coin, where the kids are also experiencing some stress of this too. Their lives have completely been changed by this pandemic. The dynamics of their schooling and their social lives have certainly been changed. What sort of changes are we seeing in the mental health of our children as a result of this pandemic? And what are some ways that parents, that teachers, that families and friends can work to help these kids through those anxieties that are being brought upon us by the pandemic?
Well, I think what's interesting, my clients, to be honest, don't seem to be having a lot of anxiety about it, which, as far as the children, adolescents go, which I'm very surprised about, because it is their future that we're focused on. But they actually seem to be very flexible and willing to go with the flow and not too anxious about it. They were much more anxious about it in the spring than they are right now. I don't know if they still think it's still over a month away. So maybe they're focused on the fact that they don't have to think about it right now. But they seem to be fairly, at least the clients that I've been working with, calm about, okay, well, either I go back to school or I don't, we'll make it work, whatever it is. But I think one of the things that is happening with the kids is that they hear the parents talking about it and they're hearing the parents' anxiety. And I think that's what kind of feeds their own anxiety. And so maybe not having these conversations around your children would be a good idea right now, just to limit their own anxiety about it, because children feed off of their parents' anxiety. So they're going to be more anxious if they notice that the parents are more anxious.
Beyond just not talking about it in the presence of your kids and stressing about that in the presence of your kids, what more can parents do to ease their anxiety so that they can have those productive conversations with their significant other, with family members, with family friends, with childcare providers, and so on, and make those decisions without bringing that stress outward into the family area where they're often these kids rock, so to speak?
Well, I definitely think that it's important to have the conversations with your kids, just not all the time. Sit down and say, what do you guys think about going to school in the fall? What if it's this? What if it's that? What if it's a hybrid? What if it's full-time in school? What if it's full-time online? What are your thoughts about it? How do you feel about it? Sit down and let them be mindful of their own emotions. And you can talk to them about your own feelings. There's nothing wrong with that. But because it's a constant conversation these days, that's the part that's unhealthy for the kids. But definitely having them tell them that you have a plan and you will figure it out for them so that they don't have to worry about it. It's the parents' responsibility to figure it out. They will do so no matter what it is. And so let them be kids. Let them, if you're allowing them to hang out with their friends, let them hang out with their friends or do social, be outside, do the things that they would do during the summer, so that they don't have to focus on the stuff that the parents have to worry about.
Dr. Melanie Schwartz with us on the Oakland County MegaCast. She's a psychologist with Viewpoint Psychology and Wellness. And Dr. Schwartz, during this pandemic, and we've talked with this about this with a substance abuse expert, another counselor that's a specific expert on this topic, but we've seen substance abuse issues on the rise as a result of the pandemic. What are some of the reasons for this increases, and is it the downtime, is it the financial struggles and other struggles that have resulted of the pandemic? Are there any specific risk factors that make substance abuse more likely to happen in one person's life versus the others during this pandemic, or is it kind of just a result of all the mounting issues piling onto somebody?
Well, it's definitely the result of all the mounting issues. It can be boredom, it can be anxiety, it can be stress, it can be depression. All of these are contributing factors. Something that's going to make one person more susceptible to becoming an issue versus another person is genetics. And if they have a substance abuse history in their family, they're more prone to it becoming a problem for them. But it's something to be mindful of regardless. If you notice that you're drinking more or you're using other substances more, it's something to be aware of, and be aware that it can happen to anyone. Anyone is not free of it becoming a problem for them. So just being very mindful of that. And I mean, people are using the substances to avoid dealing with reality, to get a break from what's going on. And, when you're stressed all the time and you're anxious all the time, or you're depressed, your depression is increased, as it seems to be for a lot of people right now. They're looking to get a break from it. So that's why the increase is happening. But it's extremely important to be mindful of it. If you can recognize that it's a problem, talk to somebody about it, whether it's a family member, someone who can get you help, talk to a therapist, whatever you need to do if you can recognize that it's an issue. And also be aware that somebody else might bring it to your attention that it could be an issue.
Dr. Melanie Schwartz with us, Viewpoint Psychology and Wellness on the Oakland County MegaCast. So in these cases, I would imagine that it's easy for somebody to utilize these different factors as a means of either escapism momentarily or just a stress relief, and then at some point maybe it becomes more reliant. At what point should somebody be in the mindset of I need to take a step back here, I'm becoming a little bit dependent on that? What can they do to mindfully recognize that dependence and then go seek help to make sure that substance use doesn't become substance abuse down the line?
Well, I think definitely if they're aware that they're using more frequently, if they went from maybe having a couple drinks once a week to having several drinks every day, or they're noticing that they need more substance, whatever it is that they're taking, to get the same feeling that they were before, that's when it becomes a problem. And that's what's.
No, go ahead, please.
Oh, that's where you need to become mindful and be aware that that's where the problem starts. And when that starts to happen, you need to back off or you need to get some help. Especially
in the times that we're in right now, Dr. Schwartz, it seems that people would be a lot of people are apprehensive to seek help when they need it, seek psychological help, especially when they need it. What can be done to overcome this kind of stigma within yourself and take that first step, or to overcome the stigma from a loved one's perspective, from a friend's perspective, a coworker's perspective, to not necessarily, I don't want to say push someone, but to encourage someone to seek the help that they need?
That's a difficult question because everyone is going through a process right now, and there's different stages of change that people go through, where they start out where they don't recognize that there's a problem that they need to deal with, whether it's substance abuse or anxiety or depression. Other people might notice it, but they don't. And then they go into more of a stage where they start to recognize it, but they're not necessarily ready for it, to make the change or seek out help. And then they start to go into the phases where they're ready to start to make the change. So you can't really push anyone, or people may not be ready to hear that they need to make a change. So that's kind of a difficult question in terms of when someone's ready or how to push them to be ready. You can't really do that. What you can do is just support them, be there for them, suggest maybe therapy would be a good idea, talking to someone would be a good idea, AA, NA, any of those things would be a good idea for them, and then just be there for them through their journey and their process of their struggle and what they're going through.
I often find that in those cases where I seek help from other people, or I want to have those conversations about my mental health with somebody that I trust and someone that I care about, or with a professional, that often there's a point where you have that realization that, okay, I need to seek some help here. I need to have a conversation with someone. And that first step, as cliche as it is to say, that first step's often the hardest one to overcome. So for someone that is in that mindset, and they know that they have maybe they have a limited time window of where they're going to be in that mindset, what can they do then to execute on that idea that I need to seek some help here? I need to have this conversation with somebody, if not professional, then somebody that I trust, to move things forward and work on my mental health before these become mounting issues.
I definitely think the services are there for them, whether they're talking to a friend, whether they're talking to a colleague, whether they're talking to a family member, who can help them find what they're looking for, what they need. That's one way to go about it. Obviously, Google, I hate to say it, is a great way to find the help that you need, whether it's a hotline or you will find the services that you need that way. We get a ton of phone calls at Viewpoint that people don't know what they need or where they want to go, and we'll talk them through and try to help them figure out what direction do they need to go. Do they need a therapist? Do they need more intensive care? Do they need an AA meeting or NA meeting? What do they need? Because a lot of people just don't know which direction to go. And so pretty much if you are calling a mental health facility, whatever that may look like, somebody will help walk you through that to help you figure out what services you need and where you can get those services.
Dr. Melanie Schwartz with us. She's a psychologist with Viewpoint Psychology and Wellness. My notes indicate that Viewpoint's now offering teletherapy sessions. How do they work? What's the feedback been like from patients regarding these sessions?
We've actually gotten really good feedback on it. And we're kind of like the schools are doing a bit of a hybrid right now as the numbers have gone down. So some of our therapists are back and they're doing a combination of in-person and teletherapy. Really what it looks like is it's very similar to being in a room, except that you're over a HIPAA compliant platform where you talk to your therapist for an hour, 45 minutes. It's generally very user-friendly. We use a variety of platforms that work for the client that we're working with. And really all they would have to do is contact our office or any office. Most practices in the area, in fact, all practices in the area are using teletherapy at this point. And they will get you set up and give you the information that you need to get started. Some people do prefer in person, which is why we kind of have this hybrid plan in place right now. And some people just do better in person, which makes sense. We all, to some degree, would prefer in person, but it's not necessarily possible right now. And I don't see teletherapy going away at all, ever, because it was here before all of this, but now I think it will be more utilized even after the pandemic because it's convenient. People don't have to go anywhere. They can do therapy from their house or from their office or from the car, from anywhere. And so it's very user-friendly, and we've gotten a lot of great results from it.
Dr. Schwartz, anything else you'd like to touch on or any lasting advice for our audience today before we let you go?
Self-care. I know I've talked about this in the past, but it is extremely important just to make sure that you are doing things that are healthy for you, that you enjoy, that are fun for you. Get out in the sun, enjoy the summer before, we're back inside and we have our cloudy, snowy days again. These are the things that will help us get through this right now. So just self-care and reach out to somebody if you need help, and the help is available for you.
Well, Dr. Schwartz, thank you very much for being with us today.
Of course. Thank you.
Appreciate it. Dr. Melanie Schwartz from Viewpoint Psychology and Wellness with us on the Oakland County MegaCast.